One, two, one, two. Check, check, check.
I'm going to introduce Susan Basso, who's also going to make a few comments, but we want to reserve the majority of the time to hear from you and again have that conversation. I think things continue to go well at the Wexner Medical Center. We've had some leadership changes over the last few weeks that we've all been reacting to, and we can have more conversation about that. A couple of announcements. So we have a new individual that's going to join the College of Medicine. Her name is Wendy Port. Wendy is going to be our Chief Administrative Officer, or really our COO for the College of Medicine at the practice plan. She'll be here, I think, in another week and a half, and I think you'll all enjoy meeting with her. She's a very engaging person who knows an incredible amount about operations and is very effective, meaning that if we need to fix something, we need to make something better, Wendy's a person that's quite capable of helping us get that across the finish line. And so I hope as many of you as possible can meet Wendy, and as some of the issues that we might discuss tonight, where we can become better and where we can improve. So I can listen, we can all collectively decide if we want to make a change or do something better or different. Wendy's job is to make that happen. And it was clear to me that we needed more hands on deck in terms of people that could help us change and move the organization forward. So I think Wendy's going to be very effective in that regard. The other is that I think many of you know that a few months ago we established a culture and collaboration committee. Tom Monger leads that. Initially it was a group of chairs, and now we've expanded that group. We have 17 members, and there's individuals that represent all levels of seniority and most of the different disease areas around the medical center. They're moving forward, getting off the ground, making, I think, a significant amount of progress. And then we spoke today about bringing in a consultant to help that group. Somebody, a group of individuals that has a lot of expertise has helped partner with a number of institutions around the country in terms of improving the culture. The group that we've chosen is McKinsey. And I thought maybe I'd just spend a couple of minutes describing their process, which I think is a really interesting one. So what they'd like to do is identify, I'm not sure the exact numbers, but say 7 different individuals that represent different parts of our organization. So maybe somebody that's a PhD scientist, another person that's a peer clinician, somebody that does both education and clinical work, and then follow a day in the life of these individuals. And so they get up at 5 in the morning, have breakfast on the way to the hospital, can't find parking, they get to their office and their secretary has quit, but they haven't been able to rehire somebody new, or alternatively, they get to their clinic and it works beautifully and patients are incredibly well taken care of. You can imagine what that day might look like for each of you individually or for those prototypes. And then after maybe even following those individuals around, but studying their lives, try to draw some parallels, across different people in our organization. And so here are 5 things that go wrong for every one of the 7. That if we could fix these things, we might make their lives better. Or here are another 2 or 3 things that go very well, but maybe we can actually enhance them and make them even better than is currently the case. And so that gives us a recipe of changes that we might make in the organization to improve the lives of our faculty. If we improve the lives of our faculty, we're all going to be more successful. And then, of course, the next phase is to try to design some way to make those changes. And then the next, of course, is to get Wendy Horton up in front of all of us and make some changes to allow us to move forward. So that's the idea behind that. But I think it's going to be a really great process, and as many of you that contribute to this as possible, please, because I think it's an opportunity to be better. So those are just a few thoughts. What I'd like to do now is introduce Susan Basso. Susan is our Senior Vice President for Human Resources for the University. She is new to our organization. She was at Penn State for many, many years during a fairly tumultuous time at Penn State, as you probably all recall. And she was the behind-the-scenes person that navigated that and made Penn State turn out just fine. And for whatever reason, I think she decided to come and take on another project, which is us, Ohio State. She arrived shortly before that epic game, and she was cheering for Ohio State, of course. But Susan, for me, has been an incredible breath of fresh air. I mean, just really a grand view of what we should be as an organization, very intent on improving HR processes. So I think a great partner for the Wexner Medical Center. So Susan, would you like to say a few words?
Thank you very much. Good evening, everyone. First, I'd like to thank Craig for extending this invitation. As you might imagine, when you're 4 months on the job, having opportunities like this to really come out and meet our employees and really hear from you, what are some of the things that are working really well and what are the things that we can do to make things better and to make your lives ultimately better. As Craig said, I was at Penn State for 7 years. I was recruited there 8 months before the scandal. And so I feel like in my career, I have had to navigate some incredibly difficult situations, and I believe that has prepared me incredibly well for, whatever lies ahead for me. I didn't choose Ohio State because I thought it was a project, not at all. I actually was very attracted to the opportunity for lots of different reasons. First and foremost, I think it's an amazing institution. You may or may not realize that at Penn State, the medical center actually is an independent corporation, so it's a little bit of a different situation. So the opportunity to really have a partnership with a preeminent academic medical center and to have the opportunity to work with individuals like yourself that are really making a major difference in people's lives was really something that really drew me to the opportunity. And of course, the Ohio State brand is pretty amazing. Every decision I've made in my career has been about where there are opportunities to go and really be able to make impactful changes, positive changes in the lives of employees. And so that's really what drives me and what I believe is going to drive my team. We're already starting to work on a strategic plan for HR. We're already working with the HR leadership team here at the medical center. And believe me, everything that we're talking about is about employees. We're talking about, our initial 3 strategic priorities are going to be around talent. So how do we get great top-tier talent to the institution? How do we keep it? What are the things that we have to do once we get people here to keep them? We're talking about HR excellence, which is what are the things that HR needs to do. So it's some of the things that Craig has talked about in terms of our processes and policies. I am someone who believes in having a culture of yes. That doesn't mean that everybody gets to have everything that they want necessarily, but it is about how do we as HR professionals sit down and listen to what it is that where people want to be ultimately, and then how do we help you get there. It may not be exactly the way that the route may not be exactly what you were anticipating, maybe a little more circuitous, but what are the things that we can do to help you get there. And having a more strategic HR is really important because we just don't push paper around. And that's often how people view HR. We have a lot more value to add in organizations to help be better and to create more individual effectiveness as well as organizational effectiveness. And then the third thing we're certainly talking about is our whole total rewards. So, really looking at our benefits and our compensation structure to really ensure that it is competitive and that we can compete with the best institutions globally. So those are kind of my initial comments, and I'm very interested in hearing from you, as I think Craig is. So I'll turn it back to Craig and to you.
Absolutely. Thoughts, comments from the group? If there's any hesitation, I know Gail's got something. She has something. Darwin?
Thank you for this opportunity. And there's a couple things I'd like to bring up and just have a discussion about. One is replacing people that we've already had. We had a person that was our fellowship program director, not director, but coordinator, and they moved on to another position. They got a master's here and moved on to Johns Hopkins actually for an administrative position. And we had a hard time replacing that person, getting that position approved that was already there. So that's something that I've experienced, that we really would like to get some thought around how we handle things like that. The other process is just hiring in general. There's a back and forth. Here's an item that you have to address. We do that. It comes back. There's a different item we have to address, and so some of that has to be worked out as we're trying to hire people. And I'm sure others will have some similar experiences around those issues.
Yeah, so it's a great question, great comments. Certainly in HR, as I mentioned, talent is going to be, a top priority. And so we really do need to look at our processes. I will say, I think from your own experience, competing for talent right now, the competition for talent right now is probably keener than it's ever been. And the institutions that are the most nimble and flexible are going to be the ones that get the talent across the threshold. I will tell you from my own experience, I hung in there, but my recruitment process took 8 months. And that is incredible. Now, it worked out great for me because I was a successful candidate, and so during that 8 months, I had an amazing opportunity to meet lots of people, to make decisions about whether this was going to be a good fit for me. But for the individuals that maybe didn't win out in the process, maybe not such a great experience, and they go out and tell a story, right? Even people that don't get the job can be really a source of terrible public relations. And so we always need to be thinking about that in our recruiting, that individuals, we're not just interviewing them and trying to get them here, they're making a decision about us as well. And so, how we present as an organization is also really, really important. And so things like culture, it isn't all just about pay. It's incredibly important, of course, and benefits. But institutions, most individuals, if asked, want to come to a place that has, strong institutional values, has a strong mission, and that they feel that they're going to really be able to make a difference there. And so those are the kinds of, compelling stories that we need to be able to tell candidates. And of course, HR has to work with you and the leadership to make the process go a lot more streamlined.
So I'm not glad you had to experience it, but at least you know what we're dealing with as against. And I think that's something we definitely need to work on as an organization. The other thing last comment I'll make is I've seen we've lost people within our organization to other parts of our organization because of differences in its benefits. And I think that's something that we need to look at because we lose talent within, like my division will go to another department or something because they're paid differently, their benefits are different, tuition benefits and things like that. I think we have to look at that.
I think we've started talking about that as well. We actually had the identical problem at Penn State. These large, complex institutions, there's lots of opportunities across the entire enterprise where people think they could go and the grass maybe looks a little greener across the street or in a different department. I think there's tons of opportunity here to bring a little bit more consistency. And the difficult part of that is we need strong partners in that conversation because there will always be a perception that there's winners and losers. So, the departments that, have a lot of resources and are able to woo those individuals, right, they're going to feel like they might be losing something if we start to, bring more consistency to the process. So, really talking that through and, socializing our plans, I think is going to be really important. But you're going to hear a lot more about it because one of the things that I know on the university side that they've been talking about, I think, for 5 years is this compensation and classification redesign work, which is a large part of it. There's so much inconsistency in the classifications. People can go to another department, do the exact same job, make $10,000 more a year, and do half the work. And that's a huge problem. So I think if we could start to address that, but we really, really have to advance the ball on that. And so I'm excited to do that work, and probably soon after the first of the year, we'll be taking a proposal to President's Cabinet to start to do some of that.
So I want to find a way to unite both of you. So I think the faculty live the difficult HR processes every day, right? You have your secretary, person leaves, you can't retain someone. And then Susan, I think at a very different level, is committed to trying to solve the problems. But it's difficult for Susan to know how to solve the problems unless she understands what they are. And so somehow connecting the two together. So what's the best way to do that? I mean, I don't think you really understand what a problem is until you live it. So seeing some very specific examples of I tried to hire this person and it didn't work, or I tried to get this person recruited and it didn't work. And if there was a way, I mean, do we create a box someplace where, you know, your worst HR nightmare can be, you know, cataloged and
Oh, please.
No.
I know it'll be full.
can we get out Susan's email?
No, but from my standpoint, I'm more than happy to connect with my administrator who's in charge of hiring for me. And I think the department administrators can also, you know, like the Department of Internal Medicine is hiring hundreds of people. So, you know, we can tell you specific examples of what's going on in the back and forth, you know, and it's not antagonistic, it's just
Sure.
process. It's just the process. And we
Yeah.
want to be partners with you to get this streamlined so we can
Yeah.
bring in, we've got some great people we want to
Sure.
bring in. And it's just harder to do that.
Yeah, and some very specific examples, to Craig's point, would be incredibly helpful.
Yeah,
And also,
give you some of that.
and if you have any suggestions,
Yeah,
you
sure,
know, if
sure.
you were, you know,
Yep.
came for a day and you could just make this process,
Yep.
you know, go, you know, very smoothly, what would have to happen?
Yep.
That would be really helpful as well.
I like that. Gail,
So this conversation about HR and how do you make it so people understand, one of the things that I think has been a real challenge for us is that the way that you make people understand, it's so centralized, this decision-making process, that there's no way they can understand. The people that are the administrators and the faculty who are out there living this every day understand why they need a nurse or a secretary but we're not having this conversation. And so I feel like all the decisions are made at one level without engaging the actual people that they affect. And I think it's a symptom of a bigger issue, which is that we're not working effectively as a team. Administration and physicians are not working together effectively as a team. There isn't this communication. Because they'll tell you what we need and why we need it, but we don't. There's been a committee that has decided. We have no voice, it feels like, in how HR goes down. All we can tell you is it's broken, and as Craig said, it affects us every day. And so it's too centralized, and we need to work more collaboratively.
Right.
And it needs a little more decentralization.
Sure, so you would say it's totally centralized, and I would say, to me, it feels like we're decentralization on steroids from an HR perspective. But you're right in terms of where there's opportunity to be better partners. One of the things that, you know, I can tell you we lived and changed dramatically while I was at Penn State. And it wasn't this conversation of central versus decentral. It was more about how do we align. And one of the ways that we did that was, and I think the medical center is already well poised because you're already kind of living in the shared services environment, right? We need to get the transactional work, right? The really mundane, what I would describe rote HR work. You know, the paperwork, the processing of documents, the inputting of pay, the processing of leave. We really need to get that off the plates of the HR people that are here to really be your business partner. Because they're the ones, they need to sit with you, they need to be strategic, they need to understand what it is that you need and how to help you get there. through no fault of their own, they have difficulty finding time to do that because they're always so mired in all of this kind of what I describe as transactional minutia. So I think from a very basic place, we need to work on the whole HR service delivery model. And that would never mean for me taking your HR business partner away from you, right? In fact, they need to even be more embedded with you and understand the needs of the business. They need to live, where you live and
So
understand
just to give
that.
you an example of that. So my department is in a building off campus. We're there, urology is there, ophthalmology is there, ENT is there. There's one HR for those 4 departments, and she was in that building and they moved her to Acton. So she's not there, there's only one for 4 departments. I mean, that just doesn't.
And
It's the
what does that
antithesis
mean?
of what
What
you're
does that
describing.
mean? Help me understand
So it
numbers
means that
wise.
she's not there, so it's hard for her to appreciate what we need.
Right.
She
So
has
how
to
many
service a
people
lot
is
of
it?
people. It's a
How-
lot. It's, I don't know, a couple hundred? At least.
Because I'll be honest with you, the national best practice for HR is 1 strategic HR person per 1,000. And I know that sounds shocking, but when HR is functioning well, it can work incredibly well.
But I think, just to, so 1 strategic HR
Right,
person.
exactly.
Not 1 person, to your point,
No.
that's doing all the
No,
paperwork.
no.
Yeah,
But
see,
strategic.
that one person is doing.
And then if that
everything.
strategic
That's right.
person,
And that's why
is-
I'm saying that doesn't work.
and that
Right.
person needs to be with you, right,
Right.
on a daily basis so that you can have access to that person. So the ratio may not be wrong. I would argue that if that's it nationally, it could be that positions are a little needier than the
And maybe-
usual individuals, so maybe the ratio is a little different for positions, but I think strategic and on site would be,
But I think the other key thing is, our practices are really different. That's, well, we're not, one
It's
specialty
fair,
is
I
very
will
different.
say, just, an early observation, there's so many opportunities to realize efficiencies, and to really kind of rethink how we're doing things. It's really, just a tremendous amount of potential. It's not gonna, it's certainly not gonna happen overnight, but having these conversations and hearing from people that are actually living it every day, because oftentimes HR people, and I've been in this profession for 30 years, HR often designs for HR, right? And we don't really pay a lot of attention to, to get out there and really listen to the people that we're supposed to be serving. Because we are a service organization. And so kind of getting back to that, I think, and, having conversations like this that inform our agenda will be really important going forward.
and I think that another thing that Susan mentioned, if we can create a culture of yes. No, the eventual answer may be no, but yes, I'm going to help you figure this out. No, we can't do it the way you might have wanted to do it, but we're going to fix the problem in the way that we can. But I think it's sort of an attitudinal change, right? We want to help. We're servant leaders. Our job is to make your lives better. And so I think it's a culture change, and one that I think Susan and I and the rest of the leaders, the many leaders in this room, I think are very invested in. Phil?
Yeah, I just want to augment that point, and I think it goes back to part of Gail's original comment. We have had a culture that there's HR and there's the rest of the world. And so I lead a faculty development center where at the very beginning we incorporated HR because of all the resources that HR can bring to the faculty. I mean, I used to tell people that HR is not just for when you're in trouble anymore. It's really to help us. So HR has great programs in leadership that we're trying to collaborate with. That but I've seen over and over again, if you go to a meeting, or I used to go to some of the leadership sessions in HR, and I'd be the only physician there. With people aren't aware of really the resources that are available for growth and support through HR. And so I think we need to develop a culture where this division is dissolved. And I think that will in part address some of the also confusion that we often have that Gail's
Yeah, no, I appreciate that, and you are actually spot on with the perception of HR. HR professionals all over the world grapple with this, because there is this perception of us as gatekeepers, policy police, obstructionists, always saying no. You know, that is quite honestly like a 1960s version of HR, honestly. And HR does bring a lot more value to an organization, and the things you described, where we can contribute to individual effectiveness, organizational effectiveness through, you know, development programs and working with organizations on culture and redesigning organizations where they might need to be redesigned. I mean, that's where our value is. And if we can, you know, get that, the transactional stuff, which has to happen, that's part of our world. If we could get that done, you know, that's important work, but the strategic level HR that needs to happen, which feels to me like it is a missing piece here that we could really improve upon.
Dave Lindsay from Trauma and ICU. I'm going to take a little heat off you today. One of the areas that
I was really enjoying this.
yeah, I know. One of the areas that I've harped on for a long time is the billing area here at Ohio State. We have such an emphasis recently with all the numbers as faculty. We've got to produce more reviews, et cetera. About 8 years ago, I started a project in the Ross in which we did coding for the hospital that increased the bottom line by about $4 to $8 million during that time period. And I suggested that the education for our young faculty would really be helpful. And I personally, when I first came here, was told many a time by billing that things could be done. And I wrote, for the first time in my life, letters to Palmetto, the Medicare people, and they'd write me a nice letter back saying, "Oh, Dr. Lindsay, thank you very much. Yes, you're right." And then I'd submit it to the people. I'd go through the process, and then I'd watch things not be billed appropriately in terms of things. And in that, I could say, I've been here 11 years now, I personally have never had an appeal for a physician bill directed to myself. I was in practice for 25 years, and that was a very common thing. In other words, there are only black and white bills that go out of here. There are no gray areas. There's never a discussion of it. And oftentimes, the responses are on the compliance side. I meet with the compliance officer routinely every 3 months and have a discussion about things, and I've backed off from my aggression because I just realized it's not going to change. But the point I want to make is that how are we going to, if we really want more revenue or we want appropriate revenue for what we do, why so much emphasis on additional RVUs? The easiest money to make is the money you've already earned appropriately coded. And getting people to work with us as a team rather than just emails to me, "Dave, are you going to stand up for the hospital because they got denied this admission?" But never are they going to say, "Well, maybe we didn't code this appropriately in your op note," or whatever. Where are we going to get that teamwork? And that's very similar to the problem of the big institution, not having people that we can talk with and really mediate these issues.
Yeah, no, I think a really good point. And in the first series of faculty meetings that we had, or faculty forums that we had, I think it was about 3 months ago, billing came up, I think, on at least 6 or 7 different occasions. So you're concerned it's not singular. Right? I think that there are a lot of people concerned about it. And so after those forums, I went on a bit of an expedition. And it became clear to me that, so if you think about, Medicare and audits and billing and coding, if you're a physician, you want to be paid for the work you do, right? But if you're an administrator at an institution, you don't want to have an unsuccessful audit, right? And those are opposing forces, right? So the physician might want to bill for everything they do, maybe get a little into the gray, and make sure everything is appropriately reimbursed. But if you're on the administrative side, you want to stay in this corner, where you're safe, and there's never any danger of a negative audit. And so as I explored, my impression was that our institution is very conservative. And in fact, as I suggested some options there was a fair amount of pushback saying, we do it well now, we've never had a negative audit, right? So there you are, we've done it well because we've not had a negative audit. There is a way to solve this, and I'm committed to do it. It just hasn't, lots of different things on my list, and it just hasn't got to the top of my list. One of the solutions is to have not a real audit, but have a group come in and pretend they're auditing. And these are groups that are very sophisticated about billing. So they'll tell you that you billed these 5 charges you shouldn't have, okay? And they'll say that you didn't bill these 20 charges and you should have. And I think once you get that data, you'll get a sense of where you are. And so if there's a little bit on each side, then maybe you're in the perfect place, right? But if there's not much on the negative side, but a lot on the positive side, then you're in the wrong place, and then we need to shift. One of the things that I did figure out as I was exploring this is that it is complicated because billing is very specialty specific. So if we were to, trauma surgery, critical care, if we were to investigate that and find out there's opportunity, it could be that in rheumatology, there's not opportunity. So it's not so easy as just bringing in one group and then figuring out the whole organization. It turns out to be more complicated. I haven't quite got my head around how to do that yet. But I think that's a way of solving this, is to have somebody come in from the outside. And we spend millions on consultants each year, so why not spend another certain amount of money on consultants, right? But I think a good chance for us to be introspective, have somebody from the outside tell us where we sit. And it could well turn out that there is opportunity, certainly in specific areas. So on my mind, I think important to a lot of people, and I think those would be the steps forward. John, you have some comments. Yes, Dr. Berger.
No, I don't. But I will just say I'll make one. So, and this is just a thought, because I think that it's starting. So welcome, and say, and just starting. Since Penn State has had many victories, and hopefully Ohio State will have at least a few more this year. Say in HR you want to have victory. And something we tried to do when I was at the division of hematology is we noticed that a lot of our support staff, and I'll speak for myself, some of our faculty were a little overweight, and some were a lot overweight, and some even got out of breath walking up the stairs, and and it was really pathetic to see. And I'll give Joe Flynn credit for this, but we talked about an initiative in our division. And we actually talked, this was before Craig was here, in Mylan Hall, about, providing for teamwork of getting groups together that exercise at lunchtime or early in the morning, and that the institution would, particularly for the physicians, we should be able to pay for what the RPEC, but for this, for the secretaries, the people that are making them a wage, that if they did that, they would get a credit to time, and they would, and they did it with everybody, and their RPAC fee would be paid, and we're self-insured, and that would really help. Because the most important thing is when people, just like eating, and to say overweight people eating together is not healthy, but overweight people exercising together is healthy, and it builds teamwork. It builds team. And we presented this, and it sort of got stuck. It got stuck, and this was long before even our last HR person was here. It sort of got stuck in HR because of the equity issues across the university and with the students and such.
Yeah.
But I mean, just as a general comment, and that was just just as a general comment. I think one thing that having a path, and maybe it's a box where, because this really stopped at HR. I mean, we had the support of the leadership, we had the support of our department, and actually Dr. Griever, before Dr. Leakley, was going to let it go to the whole department if this worked in our division. And it sort of got blocked with the equity issues. And I don't, that maybe there's not a way to work across this, but having initiatives like this, particularly given that we're self-insured, if our employees lose weight, then it's going to cost less to be insured. It's going to cost less to be insured. So I think we're still self-insured.
Yeah, absolutely. So, all I could say about something like that is, those are great ideas, and I wouldn't give up just because, 5 years ago, somebody said, there's gonna be inequity and, that isn't gonna work. I can't really speak to it because I don't know why it would have been stopped in HR and why they would have said anything about inequities, because there's inequities all over the place. And a lot of times, those kinds of initiatives, kind of what I would describe as grassroots kind of efforts, they happen one department at a time, one unit at a time, one college at a time. So, I would say if there's opportunity to revisit that with HR, and if, there's an opportunity for us to support something like that, I would never say that would be a bad thing.
Yeah, no, I think just to build on success, there are a lot of creative people. There are a lot of creative people here. And again, getting people working on the same team is getting people with creative ideas. And, and maybe it's with a college.
Yeah.
Maybe it's that we have, we sort of have the innovative help issue, or getting people to work together as teams, because we clearly need to be doing that better.
I agree, and, on the face of it, I could support something like that. I will say this is my 4th academic institution, and I think Ohio State has a stronger culture of wellness than any place I've ever been. So if it can't work here, it's not going to work anywhere.
Tom Ryan might want to mention, there's a group of anesthesiologists here that started a Ross Fit program. I think maybe he's sitting in front of me here. I mean,
I saw him eating fruit and nuts.
I don't think anybody said yes or no, or they just did it. And it's phenomenal.
Yeah, well, shoot, I was gonna.
So that's your immortals,
I'm Anthony Flores. I'm one of the cardiac anesthesiologists here in the Ross. We saw a need, and I think no one would disagree that healthcare workers, been surveyed numerous times, are actually less healthy, and they're actually sicker than the general population. Levels of burnout are at unprecedented rates. Tate Shanafelt and all his work at Mayo and Stanford have proven that physician burnout and mid-level provider burnout are at all-time highs. And so one of my colleagues and I, Dr. Tripathi, we just decided to stop getting together over a beer and commiserate and do something. And we talked to Dr. Mazzaferri and Dr. Ryan, who were very supportive. And we started a wellness project here for the Ross, and we wanted to include all the employees. And essentially, we just started a Facebook page, and it created a couple of series of challenges where they were focusing on 3 main areas surrounding active living, healthy eating, and emotional well-being. And we tried to stick to the evidence as best we could, but it was very well received. We've had over 300 and 400 participants just in the Ross, and I think there are only a total of 800 employees, so we've had at least half. This last challenge that just concluded a week ago Sunday. And I think what we've learned from it is yes, we have a great message that we want to be healthy, but we have candy bars sitting out there. We have a contract with Coca-Cola. We have a major fast food operation in the basement here, and so I think there are a lot of things, even the water cups have Coca-Cola labels on them. And I think there are a lot of things that we do well. There are tremendous strides we could make. And I think Tate Shanafelt and his work have proven that if you want to mitigate burnout, even from the lowest employees up through the physicians, one of the #1 biggest associations is that they felt supported by their institution. And so I think that we're doing a good job, but there are a lot of strides that we could really move on. But I'm really grateful for Dr. Ryan and Dr. Mazzaferri's support for the Ross Fit in the Ross Heart Hospital.
So this is a wonderful example of how sort of a grassroots effort can then change the lives of many people, all of our faculty, but not in your case just faculty, but staff, and bring faculty and staff together. So congratulations on that.
It was good team building too. I mean, it was really I just want to give a shout out. It was a very successful grassroots initiative that I think overachieved from day one. The number of people that signed up and participated actively in it throughout the whole course of the project was
right. We established a plant-based diet for the patients as well, in conjunction with Drew Patterson and the dietary division. So Go ahead, though,
So
Dr.
I
Kim.
think there's a point that comes out of this that I think is important for all of us. So some believe that if culture is going to change, it's leadership that has to change the culture. And of course, leadership is vital to the process, and there's the shadow of leaders, and so leadership is really important. But I believe that we collectively as a faculty need to find ways to change our culture. Now, the role of leadership is to be a catalyst, facilitate, enable, resource, right? That's leadership's role. But the ideas, the implementation, comes directly from our faculty. So that's exactly what you did, right? And then a great leader said, great idea, let me resource, enable, and then something really fantastic happened. If we could multiply that times 20 or 40 or whatever, and have it pervasive throughout our organization, that's how we're going to change our culture. That's how we're going to make it so that people want to be at Ohio State. So the mechanism for that, that's one of the reasons we put together this culture and communication room, is maybe a place where people can feed in these ideas, and so that maybe it isn't just in the Ross, right, but it's throughout the organization. Or maybe it is just in the Ross, but you need some resources, and so it's just a place where maybe resources can be got. And so I think more of this is what we need, and it's us solving our own culture issues, trying to move the organization forward. And my goal here is to try to create some sort of a enabling function so that we can do more of this. Andy, I didn't know if you and I have had some conversations about this in this group, this culture and community. Any thoughts about this?
Just on this particular topic, John, I think many of you have been here for a number of years. Remember from about 2011 to 2014, we actually had a health and wellness program across the medical center. Unfortunately, got cut for budgetary reasons in 2014. We had monthly lecture series. I think, Tom, you had lectured in that a couple of times. We did even had people bring their bikes in to be fit for Pelotonia in July. We did wellness walks both here at Ackerman and at East. At cooking demonstrations, actually in collaboration with the Giant Eagle Market Districts, that we had, over the course of a year, thousands of staff attend. So I think there's a real hunger for that, and then getting it back online. There's actually a small group of folks that's been meeting to kind of kick around a proposal to bring forward to the leadership on exactly those sorts of things. But then we had a larger, kind of council where you would, to your point, Susan, bring the ideas up from grassroots and from the front line on the best way to do things. So actually tomorrow afternoon, I think it starts at 5:30, but in this room there's a yoga course that the nurses put on Tuesdays. I mean, there are those pockets of best practices out there. It's just a matter of kind of getting that overarching structure back in place.
And I think, understanding where those best practices are, and, how as an institution do we rise to the highest common denominator and not sink to the lowest one, and replicate those things that are working really well. And I think on the health and wellness front, there's a great opportunity right now. I mean, I don't want to kind of misquote or misspeak, but I know my benefits group right now, I mean, there's going to be a new, we're going to be rolling out a new program with Virgin Pulse. It's going to be the new vendor. I think we're moving away from what was Limeade. Does that sound right?
Yeah.
Right? So, I mean, the capabilities that Virgin Pulse has that we didn't have with Limeade are going to present some amazing opportunities for these kind of challenges and things like that can be more systematically tracked and rewarding and things like that. So, I would say if there's opportunity to have, more discussion and have that go through, maybe HR here at the medical center, and then that, comes to us so that we can kind of help facilitate. But to the point that I think Gail made earlier, right, for a lot of these things, I don't think you need formal HR approval or endorsement. To the point, just do it.
I think
Yes, just do it, but with the backing of leadership,
Sure.
the resources, and the support to be successful.
Right.
So
What they did, this is a good example though. My wife's a chaplain here, and she works throughout the hospital, and her comment when she comes home is, Ohio State is just too big. This is occurring in the university. This is, and this has just been wonderful to, so congratulations, to say for this, and this is an example of something that's successful. We weren't successful with ours. We tried, and at the time this wasn't right. But to say this would be just something great to emulate in James, or in other, and then you have everybody, then you have everybody talking the same. Because this is just great. So congratulations.
Thank you.
So we talked a lot about hiring the best, but it's also been extremely difficult to fire the worst. So I had an individual who worked for me who was not performing correctly. I went to HR and they said, you have to do X, Y, Z, mentored, show examples. I said, wonderful, I have all the documentation, I've been doing it for 6 months. And they told me, no, that's not good enough. You have to start from this moment on and do it all over again. So I had this individual for another 6 months doing nothing, and I could not get rid of him, even though I had everything documented. So that part is also challenging, is, once somebody's here, it can be really challenging to get rid of them.
So, I would want to, not just shoot from the hip and make a comment about that. I've heard that type of thing at other institutions where I've been. I don't believe that it's impossible to get rid of people. I think it's a completely ridiculous notion. But I do think there are things that we have to do as responsible stewards, and in fairness to people, to make sure that we are documenting, we are communicating with them, we are, giving them, a fair chance to improve. But there is one of the things, an early observation that I have certainly had is kind of our culture of performance management isn't that great. Now, it may be really good on the medical center side, but certainly on the university side, it's all over the place. It's inconsistent. Some areas don't do anything. Some areas do something maybe a little bit more robustly. And so I do think, there's opportunity. And I think what I worry about at big institutions like this is people get all caught up in document the forms, right? The performance management, the performance appraisal tool, when really it's not about that at all. It's about the conversations, right? It's about how we're speaking to our employees and how we're helping them be the best that they can be. And when they can't, we need to help them move on. And admittedly, I am just learning. There's a lot of things about Ohio State law that's different from other places where I've been in terms of this, and being in a very, very public institution. But, your specific example, I would love to learn more about why that happened that way.
So just some thoughts, and maybe harkening back to our earlier conversation. What if you had an HR person that was strategic, available, and that you had access to? And what if when you first recognized there was a problem, you and that person partnered to figure out the strategy, initially to see if we could make that person better, right? Because that's the approach. But eventually, when it doesn't look like there's success there, to then have that person leave the organization. And I think what goes wrong is that you're trying to tackle that yourself, right? And you don't have that HR person as a partner. And then maybe you tackled it right, or you didn't tackle it right, according to Ohio State rules. And so you have to start over again. So I think that we can solve this by creating a much better partnership between our faculty and our HR group, and making sure that there's involvement at a very early level.
Yeah, I do. I think that's a great comment, because I think this is often what plagues HR. And this is why we're not so beloved a lot of the time, because we always get the call after the thing is completely unsalvageable. And if there was opportunity to partner early on and work with you and work with that individual, that's where we want to be. We want to be in the conversation at the beginning, not coming in, with the broom after it's already.
In this instance, it was specifically that one individual HR person who I could not get to answer my emails, could not get any help the whole time it was happening. And then this individual went on a leave, I got someone else, and it was done in 3 weeks.
Yeah, well, and that to some degree is on us as leaders, right? I mean, because what I would expect in that situation would be, and I would put this out to any of you, at any time you could pick up the phone and call me or send an email, because I am ultimately accountable for HR. And if my HR professionals are not performing at a level that you deem is satisfactory, I need to know about that.
I say a great commitment.
I have a question regarding the McKinsey and the sample size or the sample collection, how you, specifically with regard to the academic mission, clinical research. McKinsey picked up from the 70,000 employee, how, this would be selected to enhance the academic mission, clinical research?
Well, I think that most, if not all of us, are here versus someplace else because of the academic mission. And, the academic mission includes research and education, of course, but also includes growing programs and serving the community and that. So I would see academics as having to be a very important part of their analysis, right? Because that's why we're here. And no secret anywhere in the country that people are not resourced for the academic mission at the level that they want to be. That's true everywhere across the country. But no secret that I think particularly at Ohio State, people are not resourced for the academic mission at the same level as might be accomplished at other institutions, some of our comparable institutions. We have to fix that. And if we don't fix that, then we're all here for the wrong reasons. And so I'm reinforcing that I think academics has to be a very important part of their exploration. They need to follow some very academic people along that day in their life and understand why maybe they're okay in terms of seeing patients, but they're not able to get their research done or the education done or all those other things that are part of the mission. Very, very important.
I had maybe an overlap question that touched on multiple areas. So I'm an electrophysiologist here, so we're a procedure-based unit. One of the challenges we have is that we want to add faculty, even at, entry level. So bringing on a faculty, for example, in the EP lab would need to maximize benefits for both the hospital and the division. Is you're going to need additional nursing staff, because if you bring in an FTE into a lab setting, we don't have an extra lab available or we have the lab space, we don't have the extra lab staff in order to, so when that physician sees patients and schedules people for a procedure, the queue just becomes much longer, which actually creates more headaches, more dissatisfaction, and really, as the need grows, we can support additional FTEs on the hospital side, but it's very challenging to get that orchestrated when you're recruiting an entry-level faculty member without also recognizing it doesn't have to happen immediately, but you need some commitment from the hospital side that you're going to be able to recruit and keep additional nursing staff to keep a lab open, just like you would, when you recruit a new chief of CT surgery. I'm sure it's going to come with a bigger package, of course, but and I'm not really, part of the frustration from the division side is we can't really, or I'm not sure how to go about arranging that or negotiating that, or who do we talk to, and as you say, your process took you a long time. By the time a fellow gets to a point of where you want to recruit them, their window of opportunity for getting an offer is, a few months before they start moving on to elsewhere because they can't necessarily wait for that long. So to get that process faster, more efficient, it seems that the hospital and the division need to have more aligned incentives because when.
Yeah, I can probably take that on. So yes, and this is a failing of many academic medical centers that they recruit a physician, a new surgeon, and they forget that you need another anesthesiologist or another operating room or some more nurses to be able to. So it's about the physician, but not about the program, right? And so if you grow, you have to grow programs. You can't grow physicians. I think it's all about strategic planning, and then business planning. And so, and it does require being proactive. And so if the idea is our fellow looks pretty good and we'd like to bring him in, and he's going to make his decision in a couple of 3 weeks, and so I think then everybody's scrambling to figure out how to get an offer on the table for the fellow in 3 weeks, and that doesn't allow kind of a larger programmatic planning. On the other hand, if we're a year in advance, and we know, the EP program's growing at this rate, which it is, of course, and that we're going to, over the next 3 years, 3 new individuals, what's a business plan around each of those individuals in terms of, accessing more lab time, the recovery facilities, all of the different things that go along with it. And I think that the fault lies on both sides. I think maybe the administrative side in your departments and divisions for not putting that into the plan, and on the leadership side for not asking for it to be part of the plan, or if it is part of the plan, not paying attention to it. So I think we can do better on both sides. We're going to spend the next 3 days, Gail, in strategic planning. And the reason that we're doing that with each of the departments, and then eventually the service lines and institutes, is so that we can think way in advance about how we want to grow and what that looks like, giving us an incredible amount of lead time to build programs, not just one-off hiring of individuals. So it's a problem, recognize it's a problem. I think being proactive, strategic planning, being thoughtful, creating these holistic business plans is really the solution. I think we can do it better going forward.
And I think this is another example of where better partnership is needed. I think that's another way of saying what you're saying, Craig. And Dr. Dowd, I know you know this, that I think we got away from really partnering with folks, saying, what do you need when you come in? Not what do you want, not what's your wish list. But what do you need? What equipment do you need? What needs to be in the OR? What needs to be in the lab? What support staff do you need? And I think we have gotten away from that a bit here and need to get back.
Yes. It's after 6. Thank you so much for coming. Really appreciate it. We've taken notes, and we hope to see you again soon at another Factor Forum. Thanks.
Thank you.